As we begin this module on quality management and improvement, we will start by sketching out its moral and historical foundations. Clearly, quality has been a core value of nursing ever since the time of Florence Nightingale. The critical role that nurses play in the delivery, evaluation, and advancement of high quality and safe care requires that we have the expanded knowledge and of the evidence-based approaches to quality today. It is hoped that once you complete this subtopic, you will have a deeper understanding of the moral imperatives, that is, those principles and values that guide quality in the nursing profession. Also important is an understanding of how we came to be where we are. Who were those pioneers and change agents who influenced the emergence of today's patient-centered, evidence-based approach to quality improvement and patient safety? So why should quality matter to nurses? Well, first of all, society holds nurses to high standards of professional and moral competence. As members of a profession, nurses have an obligation to serve the public interest. As such, nurses are expected to have a strong body of knowledge and to have the skills and expertise to provide care. As such, then, nurses must have a strong body of knowledge and expertise in the area of quality and patient safety. Indeed, quality has been a focus of nursing ever since Florence Nightingale, when she spoke to nurses' obligation to bring forward concerns regarding safe practice. Further, quality is grounded in our ethical frameworks. If you think about some of the major principles that guide nursing practice, the ethical practice of nurses, one needs to consider those of non-maleficence and beneficence. So non-maleficence, that principle that asks us to protect persons from harm, is very much aligned to the focus on patient safety. Beneficence, which holds us as professionals to higher standards, requires us to engage in actions that benefit others, which aligns so much with the quality improvement movement, where we're always looking at ways of doing better, always looking at how we can improve the quality of care. Further, quality and safety are grounded in patient rights who expect us, who hold us accountable for delivering safe quality care. The values and principles associated with the provision of quality in nursing care are embedded in the Canadian Nurses Association Code of Ethics, which requires us to provide safe, compassionate, and competent care. These standards will be explored in more depth in the resources and exercises provided in the module. Many would say that a quality focus in healthcare has been around for centuries, way back to the time of Hippocrates, where he really focused on the principle of doing no harm. But in recent times, Florence Nightingale has been credited as being a pioneer in the area of quality, and in fact recognized as one of the first safety and quality leaders in healthcare. And as you all know, she was the first to establish standards for nursing care, and the standards are really important benchmarks when it comes to measuring quality in our system. And she really pushed the need for nurses, and in fact the entire healthcare teams, even then, a focus on collaboration and working together. So a focus on the team's accountability for safe, high quality of care. I particularly love one of her quotes were there none who were discontented with that they have, the world would never reach anything better. A really good testament to our focus today on quality improvement. In fact, oversight for quality has existed in the healthcare world, specifically in hospitals, since the mid-1900s. First established was the Joint Commission in the United States, and then followed by the Canadian Council on Health Facilities Accreditation in 1958. This organization is now called Accreditation Canada. Those of you who would have participated in such an accreditation would be aware that this engagement is voluntary, but most hospitals are unlikely to not want to be involved. It's an opportunity to really focus on the establishment and monitoring of standards. And if you think about accreditation, their real goal is to inspire opportunities for improved outcomes through these regular assessments that are undertaken against global standards. In addition to Florence Nightingale, other leaders or change agents have influenced quality in recent decades. A number of them have come from industries, specifically from the auto and airplane sector. More detail around these pioneers and their specific contribution will be provided throughout this module and in future presentations. But I wanted to specifically highlight three of the key leaders. So Edward Deming in the 1900s was an American engineer and statistician, a management consultant in industry, specifically the car industry, and a lot of his work was undertaken in Japan. Deming, who also established an institute for improvement of productivity and quality, focused on opportunities to improve quality and as a result reduce costs. And his focus was on key management principles that facilitated ongoing continuous improvement. He specifically focused on a shift in philosophy from quality assurance, which is essentially measuring what is, to ongoing quality improvement. And he designed the total quality management model that will be discussed later. Another significant innovator and leader in the quality movement was Avidas Donabedian, who focused on the development of a model that looked at quality from the perspective of structure, process, and outcome. So from a structure perspective, he considered the physical and organizational characteristics, and then the processes being the care and services delivered to patients. And those structures and processes together then influenced the outcome or the effects on patient care. This model was widely adopted in healthcare and will be discussed in greater detail shortly. The third leader I would like to highlight is Dr. Donald Berwick, who started out as a pediatrician, but then became really invested in the quality movement and was actually was the founder and the initial president and CEO of the Institute for Healthcare Improvement. Dr. Berwick was innovative in that he used the learnings from industry to influence the advancement of science and quality in healthcare. His work and the work of his organization promoted awareness of safety and quality around the world. He's engaged in solutions, focused on safety challenges, and really is well respected as a compassionate and committed leader in this area. You'll hear a lot about him and read a lot about him throughout this module, but your first introduction to him is in the next slide, where he provides a very short overview of the moral determinants of quality and care, which really reinforces the earlier overview of the moral foundation and principles associated with quality in the nursing profession. This short presentation has scoped out some of the moral imperatives for why nurses should be committed to quality, and has provided a historical overview of the quality movement and those leaders that have influenced what quality in healthcare looks like today. It's an introduction to the rest of the module, which will go deeper into some of these issues. But our next topic will also focus on key influencers of quality today, and will provide an overview of the key studies that have and continue to inform quality management.